Good morning, my name is Dr. Jeremy McAnulty with New South Wales Health. I'm here to give an update on COVID for New South Wales for Wednesday the 1st of December 2021. There were 251 cases of COVID reported in New South Wales in the 24 hours to 8 o'clock last night. The total number of confirmed cases of Omicron variant of concern remains at 5. There were more than 85,000 COVID tests reported up until 8 o'clock last night for yesterday. In terms of hospitalizations, there are currently 154 people admitted to hospital who've tested positive to COVID, with 25 in intensive care, 11 of whom require ventilation. In terms of vaccination, across New South Wales, now 94.6% of people who are 16 years and over have had one dose of vaccine, and 92.5% are fully vaccinated. For children aged 12 to 15 years, 81.3% have had one dose and 76.7% are now fully vaccinated. In terms of the ongoing sewage surveillance program to detect fragments of the virus that causes COVID in communities across New South Wales, one positive result was identified in the community of Merriwa, where there's no known cases. Everybody who's been to Merriwa recently should be really careful to watch out for symptoms of COVID and then get tested right away if you develop any of those symptoms. The number of people who have been diagnosed with the Omicron variant in New South Wales is 5. As announced yesterday, a traveller who recently arrived in New South Wales and is isolating on the Central Coast has been infected with Omicron variant of concern. The person is fully vaccinated, arrived in Sydney on flight QR 908 from Doha to Sydney on the 25th of November and travelled by private car to the Central Coast. They've been in Southern Africa and returned before New South Wales Health directed travellers who had returned from that region to enter isolation. They visited a number of venues in Sydney and on the Central Coast before the isolation rules came into effect. The full list of venues is available on the New South Wales Health website. New South Wales Health reiterates that everyone on flight QR 908 from Doha to Sydney on Thursday, the 25th of November, is considered a close contact and will need to get tested immediately for COVID-19 and isolate for 14 days, regardless of their vaccination status. New South Wales Health is contacting all passengers and flight crew to advise them of their isolation requirements. They can also call New South Wales Health on 1800 943 553 for further advice. And in line with Commonwealth measures, all travellers arriving in New South Wales who have been in South Africa, Lesotho, Botswana, Zimbabwe, Mozambique, Namibia, Eswatini and Malawi during the 14-day period before their arrival in New South Wales must enter hotel quarantine for 14 days, regardless of their vaccination status. All fully vaccinated travellers who have been in any other countries during their 14-day period before arrival in New South Wales must travel directly to their place of residence or accommodation and isolate for 72 hours. They will only be able to exit isolation at the end of the 72-hour period if they have received a negative PCR test result. These people must also complete a PCR test result on day 6 after arrival. Any unvaccinated people who arrive must go directly into 14-day mandatory hotel quarantine. So it's critical that anyone who has already arrived in New South Wales who has been in any of the 8 African countries I mentioned within the previous 14 days must immediately get tested and isolate for 14 days and call New South Wales Health on that number 1800 943 553. In this phase of the pandemic, the onus is on all of us to keep each other safe and particularly protect the most vulnerable in our communities. And so we strongly recommend wearing a mask indoors where you can't physically distance, and be really vigilant for those symptoms of COVID and get tested right away should you get even the mildest of symptoms. So again, thanks to everyone for coming forward to to get vaccinated if you're eligible. Remember to get a booster dose 6 months after your second dose. And remember to practice those sensible COVID-safe behaviours, good hand hygiene, physically distancing from other people, using a mask indoors where you can't physically distance, and getting tested, and importantly, getting vaccinated. Thanks very much.